I'd like to call this meeting, the Alexander County Board of Commissioners, into its regular session, this the 13th day of July 2026. And at this time, I'd like to call on Vice Chairman Josh Lael for our invocation and Commissioner Kent Herman for the Pledge of Allegiance. If you would, please rise.
Our most gracious Heavenly Father, thank you for this day. Thank you for allowing us to gather tonight. Dear God, help us to make decisions that will advance Alexander County and decisions that are best for the citizens of our county. Dear God, thank you for this rain that's much needed. Heavenly Father, please especially put a hedge of protection around our county employees, our emergency services, being police, fire, EMS, as well as our military. Dear God, thank you most of all for all the gifts you give us. In your name we pray. Amen.
Amen.
Amen. Attention, salute, pledge.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Does any commissioner have a report tonight? I'd like to remind everybody that on Saturday, November the 14th, that will be the next lecture as far as our 250th anniversary of the United States, and that'll be held at Bethlehem Baptist Church. And I'll continue to try to remind everyone of that as time comes by. And then this Saturday night, we have the Extraordinaries will be here Saturday night. And then on top of that, at the end of that, we will have our fireworks extravaganza. It'll be just where it was last year. Should be an exciting time. And as most of you know, when we do our fireworks, we usually do them after the 4th of July. And the reason for that being is that most of our citizens are out of town and have gone on vacation, and we try to do it when the major part of our population is here in Alexander County. And anyone else? No other comments at this time then? Gentlemen, you have the agenda before you. I entertain a motion to approve the agenda as presented.
Make a motion to approve the agenda as given.
Second.
Motion's made second. Any discussion? There being none, all those in favor indicate by raising your right hand. Those opposed likewise, motion carries. And at this time, we have some special folks with us tonight. And one of my favorite sports in the whole world is the ACHS Varsity Boys Baseball Team. They had an absolutely outstanding year, played real well. They came up just a little bit short, but they had some real good games and some outstanding games and played hard and represented Alexander County well, and especially Alexander Central High School. And the most important people they represented were themselves and the team. And at this time, I'd like to introduce Coach Pete Hardy. And Coach, if you would come forward and tell us about this team and introduce the young men, if you would.
You want me to use that?
Yes, sir, if you would, please.
First of all, I'd like to thank the board, and especially Justin, for calling and getting us to come out and recognize us tonight. This team had a great season. Super proud of them, really hard-working team, and showed first class on and off the field the entire season. You'd have been proud to watch how sportsmanlike they were during the season. This team won the Easter tournament at the Catawba County Easter tournament. Then they won the regular season title with a 9-1 record in the regular season. Then we won the conference tournament championship, and then we went to the Western Regionals, which is the Final Four. And unfortunately, we came up short in that series, but super proud of them, and they worked hard all season. And like I said, they're not only good ball players, but super guys on and off the field. And we had 3 guys make All-State this year: Carter Bowman, Jude Carter, and Gunnar Johnson made All-State. We had Koa Michael made All-Region, and we also had Player of the Year in the conference was Gunnar again, and Pitcher of the Year was Jude. So we had some guys really stand out for us this year. And we got a lot coming back next year. We got our whole pitching staff back except for one. Carter Bowman's going to Belmont Abbey to play that. We also had several guys going on to play college ball. I think it's 5 or 6 as it ended up after the season was over. We had a few more signed. So we're excited about that, excited about where we're headed in the future, and we look forward to another big year next year. We got a lot to replace in the field, but I really appreciate you recognizing these guys. They had a great season, and do you want me to have them tell you their names, or?
Absolutely, have them
Okay.
come up here and we'll get a picture of them standing up here, absolutely.
Y'all can
Introduce
come up
them.
and tell-
I mean, when you work
just
that
say-
hard.
Say your name, your position. This is our shortstop, Ty Matheson. Yeah.
Yes,
on
come up here and we'll do a little semicircle, we'll get a picture of all of them.
Our first baseman, Maddox Reese. Our pitching coach, Sellers. Brad Zadlow, he's a shortstop pitcher in our program. Cam McLean, outfielder. Caden Johnson, an infielder. Colton Pierce is a pitcher for us, an outfielder. Rhett Myers is a third baseman and pitcher. Josh Martin is a first baseman. Justin Cook, our pitching coach. And Josh Hubbard, our JV coach and varsity assistant.
All right.
Really hate this.
I will come up. Hey, Coach.
I mean,
Well, they stand up there behind them.
yeah, we stand behind
We
them.
just stand up.
Josh, you just stand straight there.
Yeah.
Hey, y'all scoot in here to move. Scoot this way.
For each one of you, have a pin for us, the Alexander County pin, okay? And you represent the county well, you represented yourselves well, and you represent Alexander Central well. I'm gonna give these to Coach Hardy, make sure you get one, and then when you wear your little suit to church, you can stick your button on, okay? All right? Appreciate it. Thank you. Sir,
We
appreciate it.
expect them to wear their uniforms every game. James, scoot in here. We hold. All right, we need to scoot over a little bit now, because we want to see. Go ahead and hire the blossom between the possums.
Cool.
Look at that.
Okay, 1, 2, 3. One more. 1, 2, 3. Reliable. Thank you very much. Thanks, guys.
Congratulations.
Good job, guys.
Thank you. Appreciate it. Appreciate your work.
Boys like it. Thank goodness that's over.
Ready to go.
Let's be real.
Cars are already leaving.
Got one at my house that we can-
The next item on our agenda, item number 7, is public comment period. And I believe we have 2 folks that have signed up to speak. And the Alexander County Board of County Commissioners public comment. The public comment period is intended to allow the Board of Commissioners an opportunity to listen to citizens' comments and concerns. It is not a time for the board to discuss issues or answer impromptu questions. A time period of 15 minutes has been established for public comment at the beginning of the first regular meeting of each month. Length of comment for each speaker is limited to 3 minutes. Please select one spokesperson to represent a group of citizens with the same concerns or questions. Comments are to be directed to the board as a whole and not to individual members. Citizens will be expected to be civil and courteous in their language and limit comments to issues of public concerns. Topics requiring further investigation will be referred to the appropriate county officials or staff and may be scheduled for a future agenda. Any citizens wishing to address the board during public comment shall call the clerk to the board prior to the meeting to have their name placed on the list. And at this time, Andy Warren, is he here? Andy?
Good evening. My name is Andy Warren, and I live here in Alexander County. At the last meeting, the board made a major change to the property tax cut after the public comment period had closed. I'm not here to argue about tax rate. I'm here because that timing meant residents had no chance to respond or ask questions. When big changes happen after the cutoff, the public loses its voice. That's not political. That's a transparency issue. So I'm asking the board to consider a simple step. If significant changes are made after the comment window closes, please reopen the public comment so residents have a fair chance to participate. Transparency matters and timing matters. Thank you.
Thank you. Thank you. Brian Whitener.
Mr. Chairman, thank you. Thank you to the commissioners. I'm probably going to throw you a curveball up here. I apologize if I get a little emotional about it, but just going to throw you a curveball here. I'm not here to complain. I'm here to thank you. Thank you for your support, specifically for the fire service. Just want to let you guys know the support that you have given the fire service for the training grounds was utilized back in May, just to let you know. Back in May 16th, we invited a handful of juniors. We advertised it quite a bit. The junior firefighter throughout the county. It was a training day that we established. Throughout that training day, there was numerous events that occurred, training events. It was all hands-on. So just to give you a little bit of a background and kind of some facts of what happened, we had 28 junior firefighters attend that day. Those junior firefighters come from Alexander County, Lincoln County, Caldwell County, Catawba County, Surrey County, Burke County, Davie County, Iredell County, and Wilkes County. We also had juniors coming from other states, but due to the college issues, they couldn't attend because they just for college issues. So nevertheless, I just want to thank you guys for the support for the training grounds in the fire service. I know many of you sitting up there supported that, had a lot of hands-on, some funding into it, pouring some money into it. So thank you for that. If you don't mind, I'd just like to thank a couple of the other people that helped with that day because it was a successful day for us. Anchor Ritchie, a local business in this county, they supported us by providing a meal. The emergency services through Alexander County, they supported us as well. Alexander County EMS, Jeffrey, thank you. The county fire marshal's office supported us, and the Alexander County Ladies Auxiliary, or the auxiliary is what they call themselves now. CVCC, the state of North Carolina, J&J Towing provided some vehicles for us. Again, all I wanted to do is say thank you. I appreciate the support, and without it, it wouldn't have happened. Hopefully, the program will keep going, or that training day will continue on, and we'll keep doing that for days to come. So thanks for the support, not only for today's fire service, but it is for tomorrow's too. So thank you.
Thank you.
Thank you, sir.
Item number 9 on the, item number 8, 2027 schedule of values presentation. Mr. Doug Fox, Tax Administrator, and Jimmy Tanner with Tanner Valuation Group.
Good evening. Thank you for letting us be here tonight. We're here to talk a little bit about the 2027 reappraisal and to present the schedule of values. I'm going to introduce Jimmy Tanner with Tanner Valuation Group to do the presentation.
Good evening, Commissioners, Manager, Clerk. Two things tonight. We're going to give you a little presentation to talk a little bit about reappraisal and what's coming up over the next few months. But also tonight's the night where we submit the schedule of values to you. We've already given Ms. Starnes the official book. All that we have is copies. They don't really count. The one she has is the official one. When this process is over, that's the one you sign, and it's maintained. The schedule of values is about a 2-month process, so included in there is a calendar when things happen. So that's about it for the schedules. We do have a little presentation we want to talk to you about and go over. It seems like we was just here not long ago. I think everybody was here in '23. All the faces look familiar, so it seems like it's not long ago, even though it's 4 years. But anyway, so we're going to do a little presentation on the reappraisal. The topics that we're going to talk about today is what is a reappraisal, what does tax value really mean, where does that tax value come from. We're going to talk a little bit about equalization and how it affects a couple of things. We're going to talk about the new valuation notices that will be going out and the appeal process that comes at the end of the whole program. What is a reappraisal? It's a process of valuing all the real estate back to 100% of market value or full market value. Now, we get caught up a lot of times talking about what is value, what's market value, true value. When we're talking about a reappraisal, we're talking about bringing the real estate back to 100% or close to market value. Now, there's 5 streams of values that goes into the total taxable value of a tax office. Real estate's just one of them. As commissioners, you probably asked, let's just say, for example, the real estate values is going up 20%. A lot of times we get that discussion about, well, if the values go up 20%, why you can't cut the tax rate 20%? And the reason is because them other 4 streams of revenue, they're already at 100%. So that skews that number. We'll talk about equalization in a little bit about why we got to be at a certain percentage, and them other 4 factors lead into that as well. And we'll talk about that on the screen later. But the key is from all the 5 streams of revenue, real estate's the only one that's being increased. The other one's already at 100%. So it's a process of ensuring all the properties are treated equally and equitably and follow North Carolina general statutes as required by the North Carolina statutes. Now, when we talk about what tax value really means, a lot of people, you'll hear people say, well, tax value shouldn't be what, I can sell it for or whatever. But in all honesty, in the year of a reappraisal, that's really what tax value is when we talk about it. But there is confusion about what tax values is. When we talk to people all the time, on the next slide, people, and they just living in the home, they're not buying, selling, not dealing with anything. They see the house as a regular house, and when they want to sell it, they talk about it in a different way. And then by the time it gets to us doing tax value stuff, we get this view of it. So, there's a little confusion on going through this, and we have to go through all of it. But really, when we talk about what tax value really means, it's true value. North Carolina's a market value state. A lot of states do taxes a lot of different ways, but in North Carolina, it has and always been, it's a market value state. And that means in the year of the reappraisal, which in this case, January 1, 2027, that means it's 100% market value as of the reappraisal date. And it basically is the same value that's expected if it was exposed to the market for purchase. In other words, if you get your tax value notice in February or whatever, and it says your house is worth $200,000, reasonably that should be about what it would bring on the market. Is what we think it should bring on the market if you was to sell it. So it really comes down to tax value, market value, sale price, all that really is the same thing. Then we talk about where do we get these values from? Where does the true value or the market value actually come from? Market value, when you're talking about residential properties, they basically, is from the buyers and sellers of the market. For residential properties, we track the sales, what they sell them for, what the attributes of each property, adds or takes away. On commercial property, it's basically rents, leases, sales, kind of dictates what the commercial property's values is going to be. So basically, when it gets down to it, we're doing these values, but where we get these values is from the property owners, the taxpayers, because they're the ones that's making these transactions in the real estate that we glean this data from and turn it into values. So when you talk about a revaluation, really what we do is we interpret the market data of sold properties and then we develop models, and we reproduce that to put values on all the properties that didn't sell. If every property in Alexander County sold in the next few months, it'd be easy to do a reappraisal. We'd say it sold for 200,000, value's 200,000. But, you know, you get less than 1-2% of the properties sell, so we have to take that information and build a lot of models and do a lot of analysis to be able to place that information back and value all the other properties based on the attributes for that property, the square footage and how old it is and the condition it is, and a whole lot of things. Now, when we was talking about the avenues of value a while ago, when we're talking about equalization, that's something that occurs because you got system property or utility property here in the county. And the statutes require equalization for utility companies. So anytime a county falls below 90% of their assessment ratio level, then there's equalization for the utilities. And the trigger is when that ratio falls below 90% and it's checked in the first, fourth, and seventh year following the reappraisal. We're doing 4-year reappraisals. So you're not, you know, we're below 90% now in Alexander County, but you're not getting triggered for equalization. If we didn't do a reappraisal in 27, you would be triggered to be giving money back to the utilities. And it's, once it goes below 10% or below 90% ratio or falls off 10%, it's direct equalization. In other words, if we saying we was at 80%, the utilities would be eligible for a 20% reduction in all the money they pay you. Now, since all them other avenues of value is at 100%, they wouldn't get equalization on 20%. It would be 20% for the real estate, and then all them other avenues figured in 100%. So it wouldn't be a 20% reduction they get on theirs. It'd be, you know, probably 16-17%. So the equalization is important. We got to be close to market value, because if you do a reappraisal and you come in at 87, 88%, then you start getting equalized that first year. And so that costs the county a lot of money. So we really have to be fairly close on what we consider to be market value. And there's no exception to that. That's North Carolina general statutes, and the state follows that every year. And once you fall below that 9% threshold, that equalization happens. Now, once we get toward the end of this, you know, we'll send out a valuation notice to every property owner will get one. It's projected to be mailed around the February, March timeframe, end of February, 1st of March. We analyze all the data through the end of December, and it generally takes 2-3 weeks for that information to flow through the Register of Deeds, come through the tax office to where we can start getting it. So it's generally around the end of January before we start finishing up all the analysis and the work. And then it takes us 2 or 3 weeks to get everything reviewed, the evaluate notices submitted for printing, and you know, make sure that they, like they're supposed to be, approve them. And so we expecting sometime around anywhere from mid-February to the 1st of March. That valuation notice will assess, it'll have the assessed value on it. It'll contain all the information that a property owner needs to appeal the property. And each one, if they go through a couple of steps of the reappraisal, every time they get a notice, it'll tell them what that value is, the decision, and it's going to give them every bit of the information they need to file another appeal level if they need to. The big thing is, if the value's reasonable, it's fair, the taxpayer gets the notice and he's like, well, yeah, I think that's what my property's worth. He doesn't need to do anything. He don't need to call us. He don't need to mail anything. If he thinks the value's fair and reasonable, which we hope and assume most of them are, that they don't have to do anything. Now, I'd be a fool to stand up here and tell you that everything's going to be perfect. That's just not the way it is. It's a numbers game, thousands of properties, and hundreds of thousands of bits of information. So yes, there'll be somebody that gets their notice and probably like, wow, I think my property's worth more than this, and we probably won't hear from them. But we'll get some that says, I think my value's too high. And we're going to go through a process, and if we can figure out what's making that value high, we fix it. But again, if they don't have no reason to appeal, they don't need to do anything. we'll mail the value notices to them. There's the avenues they got to appeal to originally is they, on that form that they get, part of that form they can fill out and send back to the tax office. Or it'll have a phone number on there that they can call and schedule an appointment, come in and talk to somebody or talk about the appeal process and what they need to do. So they got them options to do that on the appeal. Now, you have different levels of appeals. The first appeal, when they first get the notice, it'll say if you think the value is unfair, contact us. Them appeals will be done, they're informal appeals, they'll be done through the tax office, through our staff in the tax office, and that's the first level, it's informal. If they're not agreed with whatever the result of that appeal is, then what we call the first formal appeal process would be before the Alexander County Board of Equalization and Review. And they'll file that appeal and it'll go before the Board of ER. And if then they'll get a notice and it'll tell them what that decision was. And it'll also tell them if you're not happy there, you can file to the North Carolina Property Tax Commission, which that's held in Raleigh. And they can go to the Court of Appeals, they can go to North Carolina Supreme Court. So you got a lot of avenues if you got an issue. I can go ahead and tell you 95% of the problems will be resolved in that first level. Because that'll give an opportunity for the taxpayers to talk to us. We'll either identify what a problem is that's causing the value to be more than it will be or should be, and we fix it, or we convince them with the information we have to show them, here's why the value is what it is. Here's sales that we gleaned and got this information. But anyway, there's several avenues of appeal that they can go through. Information that we put out that's useful for us doing appeals is recent sales of comparable properties. They may have some information that we didn't get, damage that may not be known, visible, or available to the tax office. I mean, they could have had a leaky roof 5 years ago, and they got the new roof on, but the inside could have water damage we don't know about. They could have termites. They could have issues that there's no way we would know. So we kind of say, help us help you. Anytime they got information that's useful to us, we'd really like to get it. Property characteristics that may be incorrect. We may have area that's finished, as being finished, it's not finished. Recent fee appraisal for comparisons. If they've got a recent sale, listing information, or offers to purchase for anything on their property or something that's comparable, all of that information is useful to us. And kind of helps us figure out what the value should be if it's different than what we've got. Now, during an appeal, there's the results of an appeal. All the appeal decisions, like we said, will be mailed, including the information regarding the next level of appeal. But the results of the appeal, it can be reduced, increased, or left unchanged. Sometimes people will appeal and, we see stuff and find stuff that really should have led it to a higher value. But the majority of them it'll be the left unchanged. We'll convince them of what the value we have is correct, or they'll provide information to us that'll lead us in a value that's less than what we had. Now, one thing that's been going on, that you may have heard about some this past year, Senate Bill 889 was a property tax reappraisal moratorium that was put on the 2026 counties. Counties that did reappraisals in 2026, I don't even know if they still got it figured out, but basically what they did, if they met certain criteria and all, then them values did not take place. They got a moratorium where them 26 values will not be put in place for 2026. They'll still use the 2025 values, and then their 26 values will go in place in 27. Now, in us trying to figure out what's going on for 2027, I talked to the Department of Revenue last week, and they said there's not been no mention nowhere about any counties in 2027 being affected from this moratorium stuff. Who knows? We don't know. Legislation does a lot of interesting things. So we just simply continue to work until, something changes. But, we met with the manager the other day and we talked about this in length. We're prepared because, I've been in this forever. Legislature, make laws and they change things, and they don't think about what it takes to tax office to conform to them new rules. The camera system that they use got to make changes. The files that they use has got to be changed. So we've done things to be prepared in case they do come up at the last minute and say, well, we're not putting these 27 values in place. So we've got separate files that we can do things with to where it lessens the cost of what it would cost Alexander to get somebody to go back and redo these things. So we've kind of been a little proactive in preparing for the worst, and hopefully the worst don't come. And I say worst, it's just you got to understand you got a 27 file you're working on for over 2 years, and at the very end they say, nope, you can't put them in place. Then you got to get people to go back and put prior files in place, which is, it sounds easy, but it's not. Other than that, they're talking about some, House bills about capping the rates and things like that, which is being voted on sometime later this year. So again, who knows until it actually happens. But y'all know about as much about that as I do. So, but that's pretty much it. We'll certainly come back to you in some presentations. I was talking to the manager about probably doing maybe at least 1 to 2 more as we get further along, where we can really come back and start giving you some specifics, and especially one before the notices go out, where we can actually come back and say, around the county, this is what it's looking like pretty much exactly, because at that time we'll know. We just hadn't sent the notices. So, but unless anybody's got any questions or anything like that, Ms. Starnes has the book that needs to be kept under lock and key. And once this process is over in about 2 months, that'll be the one that y'all actually sign and is retained in your office.
Very good.
Thank you.
Thank you.
Thank
It's going to be
y'all.
interesting to see what happens.
Sir?
It's going to be interesting to see what happens.
It is. And we talked a few weeks, we've been talking over, I talk with Alexander County a lot. And, so leading up to this, we really tried to find out if there's anything rumblings going on that we hadn't heard. And like I said, I talked to Department of Revenue last Wednesday or Thursday, and they said that they've not heard anything right now about 27. It all comes down to, we had one legislature that I think had a bone to pick with Guilford County, and that started that 26 deal. And then what happened is, when that went down, then it drug a lot of counties into it. So we hope that's kind of over and done with, and everything can go back to normal. But anyway, anytime y'all need anything from me, you just get them to reach out. We'll do whatever. And sure appreciate the opportunity to come before y'all.
Thank you.
Thank you.
Thank you. Item number 9 on the agenda, Health Department Special Update. At this time, Health Director Billy Walker.
Good evening. I'm here to give a special update. I'm going to give you a review of the 2025-2026 year. It's a summary report. I'm going to review the 10 essential services and how we met those over the past year. I'm going to discuss the workforce development plan. I'm going to talk about the summary of services that we provided, and I'm going to talk about something new to y'all. It's social determinants of health. I'm going to discuss the bad debt write-off and the annual Board of Health assessment of rules, ordinances, and policies. So these are the 10 essential services of public health that we have to meet, and these are the things that we do for the community to keep our communities healthy. So if you go to the next slide, I have broken it down into each group, what we have done. So the first one is monitoring health status to identify and solve community health problems. So we monitor chronic diseases. We monitor health and safety in foods in restaurants and food establishments, and we continue monitoring for communicable diseases. Number 2, diagnose and investigate health problems and health hazards. We also monitor for communicable disease in this category. We monitor the health and safety of food as well, and we also do preparedness planning. Inform, educate, and empower people about health issues. We do this by going and educating the community. And this we did applied suicide intervention skills training, and we call that ASSIST. So you may hear that in the community that we offered the ASSIST training. So that's for that suicide intervention. And if you would remember, last year our suicide rate was high, so that's why we did that. Educate the schools on dangers of substance use and the vaping and the speedway to healthy. We also do STD training or prevention training in schools, teen pregnancy prevention in schools, and we do dental prevention education in schools. Number 4, mobilize community partnerships and actions to identify and solve health problems. I listed all some of these are new teams that we participate on. The Rural Health Transformation Grant with VIA is a new one that we're working with. Number 5 is develop policies and plans that support individual and community health efforts. So we are, that's something we're talking about tonight is our policies, but we actually created a nurse shelter plan so that when the disaster hit and we opened up the shelter, we had a list of nurses, not only from the health department, but also the school system that could work the shelter. Thyra is in there, pan flu, and measles also. We did exercises to train those plans. Number 6 is enforce laws and regulations to protect health and ensure safety. This is a continual process throughout the year, each year. We also link people to health services and assure the provision of health care when it's not available through us or somebody else. And we did that through RHA, and we used the port. We link them with WIC and what's called CMARC and CIMHARP. And then I added ARC, which is the Alexander Resource Center, and that's new. Number 8 is to assure competent public health and personal health care workforce. So we did that as well. We had all of our employees trained in ASSIST. We also had to have all of our nurses complete the certified public health nurse course. We had an environmental health specialist. He's now authorized through the state, and that's pretty significant. It's hard to do, and a lot of the counties, their newest person, it took them several tries, and Trey is our new guy, and he did it his first go round. So I was pretty proud of him. We ensure that all of our licensed staff are up to date with all the required trainings and certifications. We do public health law training and CPR. So number 9 is evaluate effectiveness of accessibility and quality of personal and population-based health services. That is our family planning quality improvement plan. We have to do an ADA assessment. We do patient satisfaction surveys, almost enough to where it probably drives our patients nuts. We're always asking them to do a survey. But we just want to make sure that they're satisfied with what's going on in our building. And then we review complaints monthly and assess where there needs to be changes. And then number 10 is hard. That's research-based, and it's hard for us because we don't have a local college. And so we actually just signed an IRB with LR for adjunct faculty. The next one is workforce development, and so this year I went a little different, and we're just going to discuss about setting goals of the future. So we actually have a workforce development plan in-house, and it's admin 5.50 is the policy number. And so this year, we did have a spike in our employee departures. And as a result of that, we're trying to identify areas of why and look at the long-term sustainability for our public health workforce. And so when I did that, it came up the same numbers-wise. Environmental health is still the biggest area of concern, being that they have the highest percentage of employees nearing retirement. Next slide. So this is the numbers that we came up with when we went back to do this research. So we have 36 positions at the health department, and 33 of those are filled. Our turnover rate was 20% this past year, which is high for us. We have 12% male employees, 88% male, and so accreditation standards, they make us compare it to what our demographic looks like. And so that's added in there as well. Retention rate in the yellow, 67% of my management team have less than 10 years from retirement. And so then 18% of my staff are less than 5 years from retirement. So that's pretty big. Go to the next slide. So this is where we compare our health department staff to what our county looks like. They make us do this. So in some areas, we're right where we need to be, and then there's some areas that we need to improve on. I listed all of our positions and how many employees are in each of those specialties. Next slide. So what does that mean? We look at the demographics of the workforce. We look at the competencies of the workforce. We take employee feedback. We go off of our evaluation and performance, and we use that to say, okay, what do we need to do to build a stronger workforce? We also collaborate with HR, with onboarding, and these are our goals. Our health educator, she has increased going to health fairs and job fairs at junior highs and high school. And it was just going to high school, and now they've started going to the junior highs and started talking to them about what our positions, what do we do? Just putting it in their mind early, so that maybe once they start into the high school age, they'll already have an idea of what classes do they want to take to gear them towards college. So then the newest thing I wanted to talk about, we've been doing this for years, but it's a new acronym that they're wanting to educate our board on. It's called Social Determinants of Health. So this is how we identify people who are already at risk. And this is what they call domains. You can go to the next slide. If you're already at risk, having health issues, you may have non-medical factors that also make your health worse, meaning that you have housing instability, food insecurity, transportation issues, interpersonal safety issues, and then there's also another optional or immediate issue that may cause you to have something to cause you to be more unhealthy than what you would normally be. And I know that here, one of our biggest things we hear is transportation. Next slide. So this is a look to how we screen for this. So this is a Bright Futures Well Child Visit. So when you take a 2-year-old to a well visit, this is some of the questions that we're going to ask during that screening. And it's stuff like, within the last 12 months, were you worried about food? And how do you get food? So go to the next slide. So what happens if they answer yes to all those? Well, we try to meet the need by starting early interventions. We try to make referrals. So this would be like DSS, WIC, or other nutrition programs. We try to link them also with the food pantries. How would they find food at a lower cost or even free? Education on that issue. What is the conditions they're facing? How can they change their lifestyle patterns that will improve that issue? If it's a diagnosis, do they even understand that diagnosis? You know, it's easy to tell somebody, hey, what's wrong with you? And they'll be shaking their head. But do they understand that? Or are they just shaking their head because you're talking to them? Can they afford the treatment for the diagnosis? And are there less expensive treatments and options for that diagnosis? And then we go into a heavier teaching and education, which is the health promotion piece. We really push having a medical home or a primary care provider that you go to each time instead of switching off and going to different primary care people, and then linking to resources. Knowing our plans, our community health assessment, and ours for the upcoming year is healthy living and mental health, and I put A and B down there to show you what those strategies are. And our SOTS report's another one, our strategic plan for 2026 through 2028. Knowing what our state and county data tells us, and also utilizing that North Carolina data portal and the county rankings portal helps us as well. Now I'm going to go into the summary of services provided. I send every month a report to y'all to let you know what we've done during that month, but this is a look at what we've done for the whole year in our programs. I also added last year and the year before that so that you can kind of see where we've increased, decreased, or stayed about the same. Any questions of all that before I go into the bad debt write-off? So bad debt write-off, this is just where we have bad debts that haven't been paid in a certain amount of time. And so we set up a payment plan that hasn't been met. So we put them on this bad debt write-off and bring them to you. Go to the next slide. So this is what we're bringing tonight, and it's an accreditation standard, and that changed from the number to the I-2, and it's securing funding now is what that's called. It's activity I-2.1. Same verbiage, just a different title. So this year it is, for the last 6 months, it's $4,465.40. And you can see that most of that is dental.
One of the most expensive things. It really is. And at this time, gentlemen, before we go into that, how did that compare to last year's debt? I mean, I know that the process had increased a little.
The last 6 months, it was, I think, I wrote it down. The last 6 months, it was approximately $1,800.
More.
And then, no, it was total. Total was about $1,800. And then last year, total was $1,600, so it's significantly higher.
Okay.
Yeah.
That's a sign.
Mm-hmm.
I would blame the Christmas parade and the candy.
Oh,
Oh, yeah.
could be. A lot of candy left on the ground too, though. Yeah. Well, gentlemen, at this time on this bad debt write-off, I'd entertain a motion to approve the bad debt write-off as requested.
Make a motion that we approve.
Second.
All right, the motion's been made and seconded. Is there any further discussion? Just so that everyone will know, even though we write this bad debt off, there are ways that you continue to look to
Yeah.
recoup this money. This is not like the county saying, guess what?
Right, yeah.
Right, I just want to make sure everybody understands that. We still have ways to recoup our money.
yeah.
And to make sure it's taken care of through taxes and when I say taxes, I'm talking about refunds on state taxes and things of that nature.
Yes.
Right, and I just want to make sure everybody understands that we're not just paying this debt off or writing it off, that it's still out there
Right.
and active.
Right.
Okay, thank you.
Well, Mr. Chairman, just one thing. I guess too, this is part of the accreditation, so if we
Yes.
have bad debt outstanding, then we get marked down for.
This
for that.
just is talking about that we have a policy with our governing body to look at this piece and have a way that y'all approve, hey, if they go into a bad debt write-off, then you approve it. It's just one of those standards.
But still, if you had a bunch of debt, it would be, they'd look at us in a different light as far as our health department.
I think it would be, we would have to review, hey, what are we doing and what could we do better?
Yeah.
Yeah, we'd have to look at our policies and procedures and our fees and our, what can we do to offer services at a different price?
It'd be more about affordability for the patient.
Okay, thank you.
Motion's made and seconded. All those in favor indicate by raising your right hand. Those opposed likewise, motion carries. Thank you. Go ahead.
The next thing is, this is new too. They're wanting, and I put the standards over there in the green on the side. We always talk about our policies. They're wanting us to review rules and ordinances that have been previously passed. So that's something we really don't talk about much as the health department. And it's always listed as Board of Health, and being our governing body, then that would be the Board of Commissioners. So I'm putting this up here for you to see. It's a new rule, and it's coming to an effect now, and we're getting reaccredited in October. And so the last 3 years, what we've done is asked the board chair and the attorney to give us a letter stating that there hasn't been a new ordinance or rule. And so that's been fine, but now they've got this new rule coming. And so since this is so new and we don't know how they're going to assess this piece, I wanted to come to the board and say, okay, this is what the activities are over there on the, in the green. I wanna come up with a tool to be able to assess some of the ordinances that are already in effect. And, how do we do that? So I've got something in mind, but I want you to sort of think about it, and we'll table it till next time and decide, hey, what's gonna be best for the board to look at rules. So I'm thinking in my mind, T21 and tobacco come to my mind, because that's something we've really talked about a lot since I've been the health director. So that's already something that you've passed in the past. So I went back to look, and if you'll go to the next, this is the template that I've looked at, just as something, hey, what can we put in effect that would help us with this? And it would be, okay, are the rules still current? Do they still apply to what's going on in our community? You may not like this format. We can revamp it. It's just, this is something for y'all to look at. Go to the next one. So this is an example. We would look at the tobacco ordinance that was passed. And I put that it was passed July 16th, 2012. So do we need to do additional information? And if not, then we would put no proposed rules needed at this time, or no additions needed. Because I'm not 100% sure this is so new of how we're going to meet this requirement. So this is just ideas. And y'all can,
It seems to me like that'd be one of those things to hash out about vaping.
yeah.
I
And
mean-
that's something, like if T21, we've already came and asked for your commitment to back us on that position that we're taking with T21. So let's say that legislation changes, then we would need to go back and say, okay, the current rule needs to change so that we are aligning with the new legislation. Yeah. But I'll know more as we move towards October. But being some of the first health departments to go through this, right now I'm at a loss on how to get this approved. So I'm hoping just this discussion we'll meet this for this time, because it is brand new. And I don't think we have time to go through all this and get this prepared before they've already, we were shut off of the dashboard, July 1. So we can't even add anything new. So this is something they're gonna have to look at when they come on to our property in October. So. The next one, this is still the same area in this standard, is how we review our policies. And I'm thinking I'm gonna do the same type of template. So when I come, it'll have that same type of template and what policies what are we doing? What are we updating? And I already do this, but I think it's gonna be easier if it's on that same template as the rules and ordinances. And you may not like it. I'm just trying to make it easier for y'all to a quick, how are we revising some of these needed requirements? So the purple are the manual revisions that were made. Those are the ones that you have to look at and approve. So I sent those a week ago for you to review prior to tonight, because there was so many. And it tells which ones that we changed and what was changed in each. Most of them are just verbiage, because the AA's changed, or due to the accreditation standards, we had to go in and change. We revamped the whole dental policy manual, so there's tons of those. And we put each one and what changed on those policies. And like I said, I sent them a week and a half ago for you to review, or a week ago. And I know that's a lot of information, but I had to come and have it.
Had to be done,
Yeah,
absolutely.
and I appreciate your time. Any questions on any of this? It's a lot.
Good information.
Thank you.
Thank y'all.
Item number 10 on the agenda, budget and ordinance amendments, number 1, Justin Mundy, County Manager.
Thank you, Mr. Chair. So there's one budget ordinance amendment for consideration for tonight. And this is to increase the sheriff's office budget for the use of federal equitable sheriff funds for the purchase of night vision goggles. These special funds must be used to increase the law enforcement budget. Fund balance is being used solely because the revenue source for this is the federal funds were received in a prior year. Therefore, we have to hit fund balance for this. So the funds were already received. It's just an accounting thing. It's not actually increasing appropriated fund balance, just on paper. It's also to increase the budget for the North Carolina Department of Military and Veteran Affairs State Grant Round 2 in order to match the funds available to spend in fiscal year 27. The grant award began in February 2026 and will be completed in fiscal year 2027. So that is the only budget ordinance amendment in front of you tonight for vote. I'll be happy to answer any questions.
Very good. Entertaining motion to approve.
Mr. Chairman, I make a motion to approve the budget amendment as presented.
Second. Motion's made second. Any further discussion? There being none, all those in favor indicate by saying, raising your right hand. All opposed likewise, the motion carries. Number 11, consent agenda. County Manager, Mr. Justin Mundy.
Thank you, Mr. Chair. There's a number of items on the consent agenda tonight. Includes some tax abatements, adjustments, and refunds, a couple sets of minutes, a line item transfer report, renewal of the Economic Development Office lease, a resolution supporting the North Carolina Division of Juvenile Justice and Delinquency Prevention legislative request for increased recurring funding, a DSS Energy Programs outreach for fiscal year '27, county employee training and certification reimbursement agreement, a school resource officer agreement with the town of Taylorsville, an amendment to the prohibited noises ordinance, and surplus of several Holliston Green Dot duty weapon sights. We'll be happy to answer any questions you may have on these items.
Anybody have any questions?
Mr. Chairman, I do. In regards to the agreement with the town of Taylorsville to provide a school resource officer at the Alexander Early College and the ACHS Student Success Center. Do you have any further information on that,
So,
Mr. Mundy?
Yeah, the sheriff's here if he wants to come up, but the town manager and police chief came forward, I believe it was a couple months back, and they wanted to take over the SRO in their city. And so I'll let the sheriff speak, further on that, but that they approached us and we spoke with our attorney, and we felt that basically it was the town's call since it was in their city, but.
Well, let me make this comment, or a question or whatnot. So I know at one time the town was trying to cover SROs for the schools in the town limits.
Yes, sir.
All right, and I do remember at one point in time, while sitting on this board, there was a lengthy period of time that I was receiving phone calls personally from citizens and other people in the community that an officer was not present a lot of times.
That's correct. Yes, sir.
Okay, so I know I hold our kids in high regard. It's their future, and I'm having a hard time with this one for a couple reasons. Consistency. I don't know if consistency's been there for the town of Taylorsville to cover. And this is, I'm not, throwing darts at nobody. I'm just concerned father, concerned citizen. And the availability, I'm assuming that they are looking to use one of their own officers.
So my understanding in the agreement and how it was presented to myself and our county manager was that they now had the ability to take back Taylorsville Elementary School. So when we went into this agreement, the only school that Taylorsville covered was the high school, Taylorsville Police Department. So then that put the sheriff's office taking care of the early college and the Student Success Center, which is just one. We share that position. It's a grant position, and that person moves back and forth throughout the day. And then the Taylorsville Elementary School. So they're actually asking to take back Taylorsville Elementary School. And so I don't know that we could say no, if you know what I mean, because it was an agreement that that ran its time. Mm-hmm. So then now, as it stands, Taylorsville Police will take care of the high school. Supposed to be 2 positions there. And then Taylorsville Elementary School, which will be 1, and then Sheriff's Office will still cover the Student Success Center, which is on the high school grounds, and then here as well at the early college. We'll have that position still.
I bring this up just to bring attention to everyone in this room and to our county that when this is, I assume it will be approved here momentarily, it could be wrong. But if this gets approved, there'll be eyes watching and people paying attention that all of our schools are covered with law officers at all times.
So just so that the chairman know, or the commissioners know, that we actually cover every school in the county. I have already set positions if someone's sick, who they call, who to go cover. Every day, we cover every school that we're responsible for, to include Millersville Christian Academy, which we went into agreement with, and they're paying for that, and then we add a position there. So I have positions set up to where if they drop what they're doing and they move and they cover a school. Actually, the agreement that I'm supposed to meet with the school system about tomorrow, in the agreement that they sent to us, that I sent to our county attorney, I asked them to change in the agreement that there was some wording in there about if someone had training or this, that, and the other. And I said I wanted to be held to a standard that if someone is not there, they're sick, that I will replace that person before that school day starts. Now, I can't help if somebody gets sick in the middle of the day and they need to step outside or whatever, but they're not leaving that school until someone's there. That's a policy of mine, and that's a good way to get fired if you leave, and I don't know about it.
Is that like an MOU or something between?
It is between us and the city.
Okay.
Yes, and we've not signed that agreement yet. We've got to talk about it tomorrow, and then I'm gonna send it to the county attorney to make sure everything's all good. Just some wording things about, everything else is just the normal. I just wanted to be held to a different standard, that if, that we're gonna have someone there every single day, whether, if someone's sick or not, we're gonna have someone there.
That's reassuring. Thank you.
You're very welcome.
Mr. Chairman,
Yes.
Sheriff Pennell, if this is voted in, will our school superintendent know that the responsibility then is to call the police department if there's a problem, or will he call you first? Who's gonna be first responder if there's a problem?
So in this meeting with the county manager, the superintendent was there, so he was aware of it from the start. So he knows, and again, we're going to be meeting tomorrow to make sure all those things. I could easily help. I don't mind to help. If they needed it, we would put someone there to help cover if they needed it. I'm just saying that the kids are most important to me too. So they would get the first call, but if they couldn't and they needed to help, then we'd make sure somebody was there.
Thanks, sir.
Anybody else?
Good deal.
Thank you.
Thanks,
Oh,
Sheriff.
and just so I can clarify, I know this wasn't asked of me, but that is drug fund money that I'm using for those night vision. I wanted everybody to know that's something that I wanted to take care of ourselves. It's something, a piece of added equipment, something that I don't think is appropriate to ask you for. So we've got that extra money, so I wanted to make sure that we used it in those types of avenues. Okay? Thank you for
Very
y'all's
good.
support.
Thank
We
you.
appreciate it.
Thank you, Sheriff.
Thanks, sir.
So I'd entertain a motion at this time, or is there any other discussion?
Make a motion to approve consent agenda as given.
Second. Is there a second?
Second.
Motion's made and seconded. Any further discussion? There being none, all in favor indicate by raising your right hand. Those opposed, likewise. Motion carries. Item number 12, closed session. We'll go into closed session under North Carolina General Statutes 143-318-11, subsection A, paragraph 5 and 6, contractual and personnel matters only. We will re-adjourn for the purposes of dismissal and adjournment only. I'll make that in the form of a motion.
Second.
Motion is made and seconded. Any discussion? There being none, all those in favor indicate by raising your right hand. Motion carries. Thank you very much. That concludes the meeting. Thank you.